We're sitting in Saskatchewan's first safe consumption site. What a safe consumption site is it's basically a facility where people who use drugs can use drugs safely and under the observations of a medical professional. More and more we're seeing drug supply becoming more and more toxic. It's being laced with things like fentanyl, and as a result people are dying, and we're starting to see record numbers of overdoses in the community. We've been working towards this site for about 5 years, and here we are, we're in the midst of an overdose epidemic, an HIV epidemic, and we have the consumption site ready to go.
We currently have very, very high rates of overdose deaths and really high rates of HIV and people living with complications of HIV. So safe consumption sites have been shown to reduce new infection rates in the communities where they exist.
People who inject drugs are costing the healthcare system over $3 million a year in Saskatoon alone. Not to mention that once again we led the country in HIV infections, which each of those infections cost $1.3 million over the course of their lifetime. What we're trying to do is to get them to bring drugs into our facilities so that they're no longer using them in full view of members of the public and improperly discarding their needles. And a big thing that's happening right now is when somebody overdoses in public, first responders have to respond, which is costing the system a lot of money, but it's also costing EMS, fire and police services a lot of time. We want to make sure that they're able to go respond to calls that are more suited to their skill set, when we can actually take a lot of those emergency calls for overdoses and bring them into our building, and our staff can handle it, and then somebody doesn't have to go to hospital and eat up that hospital bed.
Prairie harm reduction has a really crucial role to play in Saskatoon, both through their outreach programs and supervised or safe consumption. As they fill that need, we see people coming down to a point where they're more stable, and with stability comes behavior that doesn't require police intervention. And so we see them as an excellent partner in that regard.
It's been part of our commitment to work with the Saskatoon Police Service on opening this site. The 50-meter radius around our building was one of the highest crime rates in the entire city, and they've been at historic lows. That's not an accident. That's because we provide people a place that they respect, and they feel like they're a part of this community and they're integrated into this community.
I grew up learning how to cook in Vancouver, so I am used to seeing restaurants right next to safe injection sites, right next to food banks. I'm just really happy to have them as a resource so close, because I think they're actually right where they need to be, and this is a really beautiful community that kind of all bands together, so I think having them as a part of that is going to help move all of us forward and create a safer space for everyone.
The people who access services here, most of them, the majority of them, have been told their whole lives that they're not worth anything. And when people are living that life and hearing those things for so long, they really don't see a value in themselves. What we've seen for years running a drop-in center is if we just create a space where people want to be, then they start to talk to staff and they start to ask questions and they start to ask for help. And that process for a lot of the folks that come through our doors happens pretty quickly.
Once people come in, yes, they use their drugs in this facility, but a lot of sites across Canada, they don't have the benefit of what we have, which is $1 million operation on the other side of this site, which is all of our outreach services. It's not just about using drugs in the facility, it's about connecting them and getting them down that healing journey. We want to show that impact, and we want to measure it in real time. Every dollar invested in a consumption site is shown to save $2 on return. And if we want to achieve these long-term outcomes with folks, we have to keep them alive. It's really a life or death matter for our clientele. The other is we're going to be reducing crime rates in the neighborhood, we're going to be reducing needles in the city, and we're going to be increasing those connections that people can have so that they can go down that path to recovery and be successful in the long term.